So Salmonella are found in the poultry, like where you have dogs, where you have chickens, where you have turkey as well. So Salmonella is transmitted in animal products because they are mostly found in animals, in poultry animals. So it is transmitted through animal products such as milk, meat, and eggs. So Salmonella is prevented when you avoid contact with the bacteria. So uncomplicated cases of Salmonella is treated with fluid and electrolytes. So again, just like I said, causative agents, disease progression, complication, treatment, signs and symptoms. So uncomplicated cases of Salmonella is treated with fluid and electrolyte replacement. And in immunocompromised or immunosuppressed patients, or if the disease is severe, ciprofloxacin is recommended. You can use ciprofloxacin. So we looked at Shigella. And one of the signs of Shigella is frequent watery stool. It also comes with fever and intense abdominal pain. Nausea and vomiting is also common. In Shigella, your stool is going to contain blood because your intestinal lining at this point is inflamed. So your stool will contain blood. The Shigella toxin is what is responsible for the serious damage in the intestine. The Shigella toxin is what is responsible for the serious damage to the intestine. So already, even without telling you, you should know that there's a question literally coming out from this. So I said even without telling you, you should know that there is a question, there is an obvious answer to a question in your final on this slide. Shigella is transmitted through the oral route. Transmission occurs through direct person-to-person contact. It has an infectious dose, so ID, of about 10 to 200 bacteria. So you need about 10 to 200 bacteria to become infected with Shigella. And Shigella disease is mostly associated with poor sanitation, malnutrition, and crowding. So I won't go into details because we literally discussed about this extensively during the normal lecture time. So those that were in class. So I'm just going over this carefully because it is review. So transmission is through oral routes, and it occurs from person to person contact. So this disease spreads in daycare centers when you have like a lot of people, in prisons, mental institution, nursing home, and in military camps, where you have a lot of people. This disease spreads from persons to persons. And then we looked at Shigella toxins producing E. coli. Shigella toxins producing E. coli. And just like I mentioned earlier, that the Shigella toxin is what is responsible for the severe case of Shigella.
So, like, does that mean the Shigella toxin cause delusion
In this case, E. coli.
for E. coli?
Yes. So the Shigella toxins gene present on prophage genes is donated by bacteriophage in E. coli. So we looked at Shigella toxins producing E. coli transmission, and transmission occurs when you ingest contaminated or undercooked beef.
Is the infection caused by the Shiga toxin from E. coli still shigellosis?
Yes.
So that could be caused by Shigella or E. coli.
So Shigella toxin producing E. coli is transmitted when you consume or ingest contaminated or undercooked beef. For example, so we've had an outbreak of E. coli in 2015 here in the United States. So we looked at culture and diagnosis. So confirm infection with stool culture and test for the Shigella toxin. And then for prevention, the best prevention is to eat good food or good food hygiene. So the Shigella toxin is heat liable and E. coli is killed by heat. So that means you should always cook your food, your meat properly. So the use of antibiotics is not always recommended. So what is used is supportive therapy. Including plasma transfusions to dilute the toxins in the blood. And then we looked at Clostridioides difficile or C. difficile. We looked at C. difficile. C. difficile is a gram-positive endospore-forming rod. C. difficile is also part of the normal biota in the intestine. But you need to have it on a balance. It has to be balanced. If not, it can lead to colitis. C. difficile can lead to causes colitis. So in very severe cases of C. difficile, vancomycin is recommended. And because it's C. difficile releases or it is an endospore forming rod bacteria, it is very difficult to get rid of. So, but in very severe cases, vancomycin is recommended. So we looked at Vibrio cholerae or cholera. And some of the symptoms of cholera include vomiting, watery stool, some of the symptoms include vomiting, watery stool, so cholera can cause you to lose body fluid very fast. So you can lose up to 1 liter of body fluid per hour. And if not treated, or in very severe cases, patient can lose up to 50% of their body weight in the course of this disease. So cholera has a very high infectious dose. And the virulence of cholera is caused by the cholera toxin, or CT, which disrupts the normal physiology of the intestinal cells. And then we looked at food poisoning as well. We looked at food poisoning. Some of the symptoms of food poisoning include vomiting. Food poisoning also comes with diarrhea or watery stool. It comes with severe nausea as well. The food poisoning can be caused by Staph aureus can be caused by Bacillus cereus. Can also be caused by Clostridium perfringens. So food poisoning caused by Staphylococcus aureus are linked or associated with eating food such as custard, sauces, cream, pastry, processed meats, chicken salad, or ham. So you can get food poisoning that is caused by Staph aureus if your food is contaminated. Or if your food is left unrefrigerated for a few hours. So some of the symptoms includes pain, nausea, vomiting, and diarrhea. And treatment for this food poisoning is quick. So we usually don't recommend antibiotic that much, except in severe cases. But food poisoning should go away by itself. Go away by itself. And then we have the Bacillus cereus. Which is another bacteria that causes food poisoning. It's a gram-positive bacterium that are found or present in the soil. So the Bacillus cereus causes or produces two exotoxins. And one causes a diarrhea type disease, and the other one causes an emetic or vomiting disease. The emetic form is linked or associated to rice and pasta that has been cooked and kept warm for a long period of time. And then we have the Clostridium perfringens exotoxin, which is one of the bacterium that causes food poisoning. It's a gram-positive sporulating bacterium. So the endospores from Clostridium contaminate many types of food. For example, meat and fish. Meat and fish are most frequently indicated. And endospores can also be found in vegetables and beans that have not been cooked properly or thoroughly. And then we looked at hepatitis A and E viruses transmission. We looked at hepatitis. Hepatitis is associated with deficient personal hygiene and lack of public health measures. And outbreaks are common in countries that lacks adequate sewage equipment, or in countries with inadequate sewage control. So you can contact hepatitis from close institutional contact, unhygienic food handling, eating infested shellfish. You can also contact hepatitis sexually. So, prevention of hepatitis A and E is through immunization. Prevention of hepatitis A and E is through immunization. Or vaccination. I don't know, I'm feeling sleepy. It's because we have so many people here than usual.
Tired of us?
Huh?
Tired of us?
No, I'm not tired of you guys. No. I just feel off today. I don't know why. But anyways. Why are you giggling?
I was saying you're hungry.
Oh, maybe. So yeah, prevention is usually through immunization or vaccination. So we also looked at hepatitis B and D. We looked at hepatitis B and D. So there's no signs and symptoms here. So, hepatitis B and D here. So looking at disease progression can lead to permanent liver damage. Just like I said, I talked about this extensively in the class during the normal lecture time. So hepatitis B virus enters the body through a break in the skin or mucous membrane, the mucosal region, or by injection into the bloodstream. The incubation period is between 4 to 24 weeks. So, hepatitis B and D is cultured and diagnosed using serological tests. So serological tests can detect either virus antigen or antibody. So remember when we talked about when we looked at immunology or immune cells.
Can you go back one slide?
So we can also use ELISA testing to detect surface antigen to hepatitis B. An antibody tests are most valuable in patients who are negative for the antigen. So prevention of hepatitis B and D prevention is through vaccination. Vaccination. And I know I've mentioned this again and again. Whatever disease that is out there that has a vaccine, make sure you get a vaccine. It's just an advice. Get vaccinated for any infection that has a vaccine. So vaccination is one of the potent way of preventing hepatitis B and D. And then we looked at acute diarrhea. And symptoms include 3 or more loose stools within 24 hours. And it is associated with fever, abdominal pain, cramping, vomiting, and dehydration. I know some of you have had diarrhea before. So diarrhea is common. It is similar to food poisoning. So again, just like I mentioned before, that most diarrhea cases should go away within 24 to 48 hours. But in some cases, you might need antibiotic therapy or treatments. Especially in Shigella or in shigellosis, you might need quick treatments with antibiotic. So, is there any question?